This webinar is on 7 mistakes to avoid when conducting surveys around patient support services. So PeopleMetrics has been doing surveys for pharmaceutical manufacturers over the past 5 or 6 years to understand what the patient experience is with patient support services. And we've kind of gathered a lot of kind of best practices and mistakes that we've noticed, that can be made, and we hope we can help you avoid them. So this is what this whole webinar is about. So let's have a good time, and hopefully there'll be some really good content for you to apply right away. All right, so by the end of this webinar, you'll learn a few things. One, the 7 most common mistakes that we see when manufacturers embark on these patient support survey programs. And the flip side of that is tips on how to avoid them. And then we'll summarize at the very end on kind of what we think are the key best practices to creating a really high-level, effective survey program for your patient support services offering. And as I was saying, PeopleMetrics, what we're talking about is surveys that are being sent to patients, or in some cases, HCPs, nurses, other healthcare professionals around the experience they have with patient support services offered by manufacturers or partners like hubs that may be offering these services for the manufacturer. So just to set context on sort of what we're talking about here. Real quick about PeopleMetrics, we've been invested in patient support services since 2015. We've done work with quite a few manufacturers in this area. We write regular content on this, on patient support services and best practices and creating a patient experience that's a really good one in our blog. When there were events, that's me. You could see me speaking at an event. That, of course, isn't happening right now. We do a bunch of independent research. Our latest one was on rheumatoid arthritis and patient support services being delivered for that therapeutic area. If anybody's interested in that, I think we have some really good, we have a good video on that. Just let us know. And I'm also working on a book called Pharma CX Secrets that talks a lot about what we've learned in terms of creating a great experience for pharma stakeholders, which are primarily patients, HCPs. I'm excited to share what we've learned. Okay, so let's get right to it. What are the 7 mistakes that we see most often when designing these type programs? The number 1 mistake is deciding not to measure patient feedback. So we hear sometimes things like, well, it's not a top priority. Somebody else is responsible for the feedback, or I don't really know how to do it. And this is a mistake. So let's get into this a little bit why. First of all, let's move on to the next slide. First of all, let's get to a poll question. What we've seen over the years is patient support services is becoming more prevalent. And we want to ask the audience, how much do you think awareness of patient support services has changed since 2015? So do you think it stayed the same, or has it increased 12%, 27%, 33%, 42%? We've measured this recently, and we also have data from 2015, so we'll share kind of how that's going. So why don't you do that? Take a sec, and let's look at the results. Increased by 42%. All right, stayed the same. The next most frequent answer, 18%. Is by 33. Okay, let's look at the answer here, Kirk. And the answer is increased by 33%. So in 2015, about 1 in 5 patients were aware of patient support services being offered by pharmaceutical companies and their partners. And just last year was over 52%. And my guess is now it would be even higher if we were measuring this today. Okay, so that's really interesting, right? So the key thing is people are aware of these services. So their expectation is that there'll be some, at least half your patients. Okay. And so the next one is measuring the patient experience. So how do you do that? We often do this through a question like this. Is if people are familiar with Net Promoter Score, NPS, it's kind of like a Net Promoter Score scale where it's 0 to 10. And those that are satisfied are 9s and 10s. That's what they're considered satisfied. If they're saying 0 to 6, they're not satisfied. So we're measuring the satisfaction with patient support programs like this. And so we have another poll question, I think, right, Kirk? What percentage do you think of patients that are satisfied with patient support services programs? See what you think. We'll give you a minute. 13 is very low, 62 is really high, or could there be something in between? Okay, let's see the results. So 26% thought it was 44, or 26, right, 44% thought it was 26. Wow, okay. Not many people thought it was very high. Okay, let's take a look at the results. About half the patients are satisfied with their patient support service program. So that means half aren't. And that's a reason to measure this to begin with. So if half of your patients who experience the patient support services aren't satisfied with the experience, it's worthy to look at that in and of itself. But there's even a bigger reason to do this.
And I would just note there, and I think something that gets folks is, of course, when we say satisfied, we're talking about the top of the scale there, 9 and 10. The reason for that being, if you are responding to a question like this and you're giving a 7 or an 8, there's something that's really gone wrong. And you can even think about this in your life as a consumer, where if you're rating something out of 5 stars, folks who are giving 4 stars often, when you see some 4-star rating, it's because something went wrong. And so if you're doing enough to get below that 9 or 10, there's something that really needs to be addressed.
For sure. Okay, let's continue. This is on the first mistake. Remember, people who don't want to measure this for some reason. Okay, so the other key measure that we look at is, has your patient support program adequately prepared you for treatment? We ask just a simple yes/no question, and this is one of our key questions that we ask often. Okay, and let's see what we have there. Most people are, so 84%, but there are, 16% is still a lot of patients in many cases. And let's tie together satisfaction and this, and this is why you should measure patient support services all the time. That's the next slide. So those who are not satisfied with the patient support services program, about half of them are not prepared to begin treatment. Those who are not prepared to begin treatment typically don't onboard, and they certainly aren't adhering to the treatment regimen over time, and they're not receiving the outcomes that were meant for them when it was prescribed by an HCP to begin with. And those who are satisfied, those 9s and 10s, this little smile over there on the far right, almost all of them are ready for and prepared for treatment, meaning they're going to onboard and likely adhere over time and hopefully experience positive outcomes. So what we're trying to do here is just build a case on an ROI case of, why this really should be measured, because if you figure out why someone isn't satisfied or does not have a great experience and can fix it, then you're going to be able to have more patients onboarding and adhering. That's mistake number 1.
Absolutely. And the way I tend to think about this for these programs that I've been a part of is that, of course, the goal of support services is to prepare patients for treatment. On the whole, there is a good job there. 86% of patients feel that way. And so if you get it right, patients are going to feel prepared. If there's any drop at all, you see a major impact.
All right. Let's get to mistake number 2. Mistake number 2 is leaving the patient experience to partners. So sometimes we hear, I don't need to worry about this. I have a partner hub. They have their own process, and we don't want to ask about an experience we don't control. Here's the thing. When outsourced to hubs are great, and I think it's really a smart strategy in some cases, but no matter whether you being a manufacturer are delivering these services yourself or using a partner, you still own the experience that the patients have. The patients don't care really about who is delivering it. They just care about having a good experience getting the support they need to onboard into their new medication and their new life stage, right? So they don't care about any of that, who is offering it. They care about what is being offered. And I would suggest that even if you're using a partner hub, it perhaps is even more important to measure this, just to make sure that the patient experience is kind of where you want it to be. And on the next slide, we show kind of further evidence of why we think this matters here. This is some data we've collected around the patient experience at various stages of the journey, from copay assistance to primary access to nursing support and some other things in between. And the key point I want to show here is that the experience varies depending on some of these touch points that, some of which the hub may be offering, some of which you may be offering in-house, and some of it you have no control of whatsoever. But it's still important to know, what the patient experience is, so you can figure out different support programs for that patient to account for it. So we're seeing that, we see this over and over again. And our strong suggestion is no matter who is delivering the services, they need to be measured. Kirk, do you have anything else on this one?
Yes, what I would add to this is I think one of the common refrains we hear, there is this tendency to say, we don't want to know about it. It's not ours, so we don't want to know about it. But really, that goes against what these support programs are about. These are intended to be kind of weaving together the fact that a patient has to go through a patchwork of different organizations in order to get to their treatment. Whether or not you are responsible, or it's third party, or it's something that's else, patients see their support program as responsible, and they can rate you on this regardless. And that's really kind of.
And here's a couple of examples, right, Kirk, of these are patients that we've heard from, difficult to communicate with third-party provider, they frequently fail to respond, approval process is frustrating, there's disconnects. I mean, these are things that we see all the time. I mean, and it's our view that the manufacturer should be both aware of these things and be part of the conversation on how to improve them if they're using a partner.
Precisely. Certainly, in the case of if it's a partner hub that you're working with, that's absolutely feedback that you want to collect, so you can coordinate on that experience and make sure you are providing it. However, if it's also something that's totally out of your control, you want to be aware of that so you have that ability to guide patients most effectively through their journey.
Okay, the third mistake, starting out by boiling the ocean and measuring every touch point. So sometimes when we work with new clients, they want to measure every touch point all at once because they want data for every team, they want to be thorough, and they don't want to miss anything, and we get it. And this should be the goal of measuring thoroughly every touch point that a patient may have in their journey. But in the beginning, we recommend there's two different options that you should think about. And the options are either a relationship survey, which is a high-level kind of overview of what patients are feeling about their relationship with you and their patient support services being offered, and that's a very broad approach, or being super, super specific and honing in on one key milestone and understanding that really specifically and taking action on that individual patient feedback to create a better experience for a patient within that touch point. And we have a couple kind of workflows on how these work that hopefully will become more clear. So this is a relationship survey. So what you would do, and this isn't often a place where our clients start because it's easy and you can get this done within a few weeks. So it's something that there is a beginning and an end. So the way this works is you identify all patients who are enrolled in your treatment and your patient support services program. You reach out to them. Usually it's an annual type study, although we've seen some of our clients move to more frequent measurement, twice a year or even quarterly. But let's think about it as annual for now. And an invitation is sent to these patients that's really in-depth. So it's it's an in-depth kind of look at what their relationship is in terms of everything that they've done with you over the past whatever time they've been a patient. And it's really to understand a baseline of what their experience has been. These surveys can be 20 minutes or so, and you can see once they submit it, generally they receive an honorarium as well, because it does take them quite a while to fill it out. Not like we said, this is usually a few week period of time, so the results are available via our software platform, but it's just to kind of check in on kind of what are the preliminary results. The big deliverable is, we put together a report typically for our client, and they share it to some key stakeholders on kind of what is the overall experience with the patients, what did they find valuable in terms of what they've received from patient support services, what are some things that they'd like to see improve, and a variety of other type of questions, right? Kirk, you've run quite a few of these. There's a lot of other questions that get included in, around potentially new technology that could be introduced. Like there's a lot you can put in here.
It certainly is. Yes, the relationship survey is something clients want this when they really just don't have any kind of baseline. They're not really certain of where the patient experience sits. Since this is a longer form survey, it does allow you to just ask more questions on the overall patient journey. Something we often see as well is competitor ratings of, have you had experience with other support programs? How would you rate ours versus theirs? As well as, were there any specific offerings that they had that you would like to see applied to in your experience today? And as well, if you have any offerings you're considering rolling out, this is a good time to test these ideas with the patient and get their thoughts.
Exactly. All right, so this is one option. It's a great option to begin. And the other option is the key milestone survey that we mentioned earlier. So what a key milestone survey is you hone in on something specific, like a welcome call or first infusion, change in insurance, some sort of field interaction. Sometimes our clients have like a broad category of onboarding as a key milestone. But the difference between this and a relationship survey is, instead of reaching out to all patients, you're only reaching out to the patients who experience that milestone, right? And you reach out to them as soon as possible after they achieve that milestone, whether it be a welcome call, first infusion, et cetera. And this is a brief survey, right? So this is a few minutes, 3, 4, 5 minutes at the most. The patient submits the survey. There's no honorarium because it's short. And this then gets fed into our software platform, and the results get distributed to different people within the organization who have frontline access to the patient at times. And if a patient, for instance, isn't prepared for treatment, a follow-up is possible to make sure that there's nothing else they need to onboard onto their new medication. We also aggregate the results and trends, but the big point on this is a continuous program. There's not a beginning and end, because people are constantly having experiences on these touch points and these milestones. So what you're doing is you're reaching out to them on a continuous basis, you're understanding how you're doing, you're responding when appropriate, and you're making tweaks to the program based on the findings to improve the experience overall. This is often a great way to start if you want to get right at like sort of actionable feedback that's more granular. The relationship survey is a great way to start if you want like a high level baseline on what's going on. And this also, of course, requires an interaction between us or whoever you're using and your kind of IT or whoever is tracking the interactions you have with patients, because that feed has to come in continuously.
Absolutely.
Mark, anything else on this one?
Yeah, absolutely. To add to what you said, you can't go wrong with either one of these, but the mistake is really make sure you pick just one. It is easy to want to do a lot at first. If you don't have any feedback, you want to learn a lot. But start with one and build on that after you have success. So start with the relationship survey, or pick one of those milestones and start with that first. Exactly as you said, it's either do I want a broad baseline, or do I want targeted something more for coaching and building on that specific experience? And then that's about it.
Kirk, a lot of our clients do both of these, right? In a year, they'll start with relationship, hone in on a key milestone, and then repeat the relationship survey on an annual basis just to see how they're doing kind of at a high level year to year.
Yes, really these two feed into one another. They should support each other in that the relationship survey provides guidance for your overall program because it is more broad. It is about a whole overview of your offering to patients. The key milestone is specific on you just had an interaction. How is that interaction? So the relationship survey can help give you that broad perspective to say, here's where we should invest some more effort. Maybe we want a milestone survey at this point to really dig in and get more granular feedback. And then kind of what you learned from that milestone survey then feeds back into larger questions you may have into a future relationship effort. So they weave together over time.
All right. Let's get to mistake number 4. Oh, a poll question first. Yes. We have a poll question, don't we? Let's get to it. Thinking about these approaches, which have you used for your patient support services programs surveys? Relationship, key milestone, both, or none? Let's see what we got here. None, and a mixture of those. Great. Glad to see people are using these. All right. Let's see, mistake number 4, ask patients the wrong questions, right? So we have clients that say, I just don't know what to ask. I have some questions from market research I want to include. Can we add a lot more questions? Are these going to get through legal? How long will that take? So we have, I think, something that would be a good solution for most companies, and I'd like to share it with you now. So we've done so much work in this space. We've been able to sort of understand what the patient needs are, and we've developed questions around these needs. And if you're familiar with Maslow's hierarchy of needs, this is very similar, where you have kind of a base need, and after you fill that need, you go to the next level of the triangle. So this is what we've learned about what patients kind of want when they're onboarding onto a new medication. One is that they can afford it. So there's some sort of financial security. The second level is logistical support. That means I know I can get my medication and get it within a reasonable time frame. So I know where to get it, and I'm confident I can get this medicine. I know where to get it. The third level after logistical support is I know how to administer this medicine, especially relevant for injectables and things like that. So that's the next level. So these are kind of the base levels of really getting a patient ready to onboard. The next level is support. There's some sort of support system, meaning I can easily get answers to my questions, right? And the top level is confidence, that I'm confident that I'm prepared for treatment. I'm ready to begin this new phase of my life. I'm ready to experience the outcomes that my HCP and others believe I can achieve. And what we've done after learning from this, just doing these surveys for so long, we've created a question set that's 15 questions that align to these different categories. And they've been vetted by multiple legal teams within manufacturers. And here's an example of questions for each level. So for financial security, for instance, did your case manager clearly explain your financial assistance options? So that's a question that is directly related to financial security. Or logistical support, did our support services make it easy for you to find a physical treatment location? Right, so that's a question that we use often. The administration level is, are the instructional materials you received on administering your medication easy to understand? Support system, is the case manager accessible when you have questions? And confidence is a really key one, and this is a question we introduced before, but it's one that's very, very effective, is do you feel that your experience has adequately prepared you for treatment, to begin treatment? So there's 10 others questions in addition to these 5, if you're interested in them, just shoot us a note. We're happy to shoot them over to you. But this is a great start for you or anyone who's interested in beginning a patient support services program and wants, some questions that have worked, in numerous cases, and we have benchmarks that we've developed around these, and et cetera. So that's some ideas for you to begin.
What I'd add to this, I think you said this was very important, Sean, is the fact that it is that kind of hierarchy of needs, and that you need each level of the pyramid before you can move up. That treatment preparedness, sense of confidence means that you need to satisfy each of these. Some of these are very base, and what we generally find is that patient support programs do a great job on that first level, because that is what they're primarily there for, is to help you navigate your insurance. Generally do pretty well on these next 2, not always the case, but generally they do pretty well. They much more commonly trip up on being a sense of support for the patient, and that's where you're going to see that drop in patient satisfaction. You're going to see that drop in they just don't feel prepared for treatment, even though you've gotten them, you've gotten them 70% of the way there, but they're still not yet ready.
All right, Kirk, I think this is, now you're going to take over for the last few.
All right. So once you've kind of gone through this process, if you've overcome the hurdles we've discussed thus far, in that right survey, the right questions, one of the last major hurdles we find is sending the survey via the wrong channels. We have clients that come to us, will say either we haven't gotten a lot of responses in the past, or we've used paper surveys, or we don't know how to reach out to folks. And it's not surprising, because there are a lot of options out there as to how you can send surveys. What you'll see in the space today, most commonly, if you're fielding this kind of survey, is email, text, IVR, if it's a call center, reaching out via patient advocacy groups, surveys directly on a website, or an iPad if it's some sort of field interaction. With that, we have a quick poll question to ask the folks on the team of, have you utilized any of these in the past? And kind of from there, we'll tell you, what is the most common of these. All right. Web surveys are the most popular here on the line, followed by email and patient advocacy groups. And I think when it comes to kind of what's interesting here, this is a little deviation from what is most common out there today, as the most common are email and text surveys. Web surveys also are a component, but you tend to see email and text. The reason for that being they are just used by the most patients. It's often a matter of meeting patients where they are. So that's how you can reach them. You're also able to track every response in a way that a survey that's on a website, that can be a little trickier to actually track who is responding. And you can get very detailed responses. You can be a little more longer form if you have them for an email or you have them for a text, rather than if it's an IVR survey, that certainly the threshold is a lot lower. And even if someone's on a website, it's a little lower. That's not to say that these are the only ones. Of course, as I said, it's about meeting patients where they are. So it depends on your goals to which one you're going to use. But what we generally recommend when starting off a program is this, because it's the best way to get that most volume and get folks started. Something to think about, consent is often the biggest hurdle that we see, and that's part of this issue. So if you are starting off a feedback program, something that you need to be mindful of is reviewing your consent now if you're just in this thought process. And if you find it's not something that's there for surveys, make it part of your regular process. For clients that we've had where they just don't have this consent yet, they then incorporate that as a part of their regular outreach or as a part of their permissions for whether that's an actual person asking or some other outreach they have. And finally, consider other channels if needed. These are not the be-all, end-all. And so we've really worked in all of those that we listed above, as it's a matter of picking the channel where you can meet patients the best. And with that, we are on to kind of two last mistakes that for these, we're going to review them together because they're really about what you do with the data and how you make them valuable. The first is keeping the patient feedback to yourself. And this is often a kind of market research holdover. But this is not market research. It's not a silo. You don't want to say we're keeping this to a core team or that this is kind of just for patient services. This seventh and last one that really ties in with this is not responding to negative patient experiences. Again, this is a kind of commonly just market research holdover mindset of we're focused on broader actions, or we don't have a process for then following up once we collect this feedback. When it comes to doing these two correctly, as far as sharing the feedback and acting on the negative feedback, we're going to jump into the People Metrics platform that we mentioned earlier. This is how we share feedback with our clients to show you how to do it right. We click on this, and we're going to be jumping into an example of one of those key milestone surveys. And really, for that first one of not sharing the data out, getting data into the right hands is key. What we're looking at here is an example reporting dashboard for someone who is a supervisor at a call center. We want to get that data right in their hands so they have satisfaction for their group, any of the key metrics, financial clarity and accessibility, and most importantly, data for the group below them. Here we're looking at individual case managers. And for them, they should be able to come to an individual screen. I can click on one of them and see now I'm just looking at Betty Benson here, and now I'm looking at a screen that Betty Benson would have if she were to log in as a case manager. And that's really key, is that everyone has their own view. Generally with these programs, it's best practice to have a view for every level of your hierarchy. There's no need to keep this to yourself as a stakeholder. And what's done, there's an overall report, supervisor report, manager report, and then any kind of specific details below. You want to have everyone who is responsible for the patient experience have the ability to access that data. And ultimately, it should be easy to do that. We at People Metrics do that, setting up roles that are specific to the team, and then everyone goes to the screen that's specific to them and has access based on what they should see. But as long as you have that access set up right, you should be fine to share that data out. The last one there was about actually taking action on that data and not responding to patient feedback. And really, the solution for that is you need to make someone responsible for follow-up. This isn't market research data. So when a negative response comes in, someone should act on it. Commonly, that's a supervisor, and what we do is we put that right in platform. So all the negative responses that come in, whoever is responsible for that on your team should be able to come to a screen. They can review those responses and ultimately move them from something that has come in and something that's yet to be evaluated to something that's resolved. Patients have taken the time to give this feedback, so you do want to click into everyone, view their survey responses so you can see their feedback. What we generally do is, in this case, assign it to someone, they'll review the survey feedback. In this particular example, it was a treatment location issue, and you could come and assign kind of a root cause to this issue of saying, ultimately this was a location convenience, not convenient. Comment. Something like this will be very important to success of your program is acting on everyone. And with that, we want to kind of wrap up those 7 issues by tying it together in what are the 7 best practices. Start at the top. Measure patient feedback because there is an ROI to it. Do that regardless of who delivers it because it's incumbent on the patient journey. Start with one survey, either a relationship or one milestone that's important to you. Use questions that are proven, have benchmarks, and are relevant to the patient. We're, of course, we have a little biased. We have our own benchmarks, but you want it to be something that matters to the patient. Generally, you want to start out using an email or text. It's not the case with every group, but that's the best if you're starting a program. Share that feedback with all the stakeholders. Don't keep it to yourself. And finally, take action on those poor patient experiences, because they're in the middle of this journey and you're there to help them. All right. And with that, I think that takes us to the end of our session. We're on to the Q&A.
Great. All right. So we have some questions, Kirk. We have one here that asks, how are surveys administered via email?
That's a great question.
Yeah.
So generally, technically, the way that this works is you're going to be working with patients that you have some sort of consent from them. It's often kind of marketing consent, or if you're working with a hub or a specialty pharmacy that they've collected some consent. With a survey partner like Peoplemetrics, you would have a data hookup where we're receiving a list of those consented patients who reach a milestone and sending them that survey via email. Often that is sent over as some sort of API file or SFTP file, and that's most commonly how that process works.
Great. Yeah, anybody else who has questions, please send them. Kurt. Okay, here's a question. How do you handle adverse events with these type of programs? I know, Kirk, you've done a lot of this. Why don't you take that on?
Yeah, that's an important one, and I would say in a couple ways. One, I would say, don't let adverse events scare you away from this. That's another reason why people tend to say we don't want to collect this feedback, because we're scared of adverse events. 99% of these are avoided just by how you ask your question. When you're asking about the patient experience, they're responding to that patient experience. They're not responding to the aspects of their medication unless you're prompting them, and that's not what you're going to prompt them to answer about. Very rarely we do get responses on adverse events. When you are fielding a survey or working with a survey provider, our approach is that we monitor all the responses daily. Every company has their own adverse event policy. We generally train with those and then follow that policy. So if one comes in, those are reported and sent along. However, that's a very rare occurrence, just because you get ahead of that by making sure the questions you ask are not speaking to those items.
Here's another one, Kirk, that I think you'd be good to answer. We work with doctors' offices as well. Are they different? Do you include HCP feedback in these programs?
Definitely. And that's another thing that is certainly very important. You do want feedback on HCPs. Speaking back to that, don't boil the ocean. HCPs are commonly a second step where it goes. But HCP feedback is important because they're the primary advocate for these types of support programs. They're the ones who make patients aware of these. And so you need to make sure that they're having a positive experience when they call into you as well. Reaching out to them is going to be a little different. They're going to have shorter surveys because they don't have that same kind of time. And it's going to be a little more targeted in how you reach out to them, but they are going to give you a very important perspective.
Absolutely. Here's one I'll take, Kirk. Is rare disease products different from other sort of more mass market products when it comes to patient support measurement? And the answer is definitely. If our model has a component of case manager feedback in it, which is a lot of rare disease, and you want to be able to tailor the questions to kind of the support services you offer. For larger products, there's a lot of digital support via apps, websites, portals, and we've done those as well. And those questions obviously would be slightly different, although the key questions around being prepared for treatment are the same, and some of the core levels of our model are the same in terms of making sure they understand the financial part of it, understanding the administration part of it, and the logistical part of it, it's all there. It's just, slightly different. But yeah, the questions would be slightly different for rare disease versus larger product markets, and something definitely to consider. The way you're delivering the patient support services would be slightly different. So it is definitely something to keep in mind. But we think both of them should be measured, and there's a lot of value to doing that. Kirk, here's another one up your alley. How do you make sure patients don't get too many surveys at once? How do you make sure they're not over-surveyed, especially if you're doing like sort of multiple milestones and you're doing a relationship survey too, maybe once a year?
Yeah, that's something that ultimately you need to be very purposeful in how you're approaching that. So when you're picking your milestones, as far as how we're going to survey, you want to pick ones that are distinct enough, far enough apart, so that when you are picking patients, you're not being bothersome. So pick those milestones that are a good enough distance. And also, you just generally are going to have survey rules in place. Of course, with us as a survey partner, you can set up limits to a patient only receives, X number of surveys per year. That way, you can ensure that even if you're going throughout these milestones, you're not going to be over-surveying a patient and becoming part of that burden as being the feedback. That's what you really want to avoid, and that's why it's important that you're very conscious in how you're setting up that program.
Okay. Let's see, I think that's all we have in terms of questions, and we're almost at 45 minutes, so I think this is a good time to wrap up. I want to thank everybody who's joined us. Patient support services are something that's growing, as we all know. Awareness is getting higher. It's not going to go down. And measuring this and making the patient experience better and better is, I think, going to be more and more common, and something that you're going to see as kind of a standard going forward. And we really enjoyed sharing what we've learned so far in our journey helping manufacturers in this area, and we'll be certainly having more of these in the future. And subscribe to our blog and everything else if you haven't. And we're excited to be in this space and helping as we can. Here's how you get in touch. Connect to People Metrics. That's our website. We're on all the usual social channels as well. Thanks for attending.
Thank you all.